Order, order. Before I call Andrew Sellis to move the motion, I just want a little bit of clarity. As ever, there won't be an opportunity for the member in charge to wind up, as is the convention for a 30-minute debate. Actually, we do have a spare 10 minutes because the other debate finished a bit earlier, so there is going to be a little bit more flexibility, but don't abuse the flexibility. And on that basis, because I know there are a couple of minutes who want to intervene and also want to speak, so there'll be some flexibility at the discretion to some extent of the member and the minister. So just bear that in mind if you do want to intervene or speak. On that basis, I'll call Andrew Sellis to move the motion and call the minister to respond. And as I said, there won't be an opportunity at the end for Andrew Sellis to wind up. Order, order. Andrew Sellis to move the motion.
Well, thank you very much, Mr. Dowd, and I'm delighted to be able to serve under your chairmanship, and I'm extremely grateful to colleagues from across the House who have turned up to attend this important debate this afternoon. So we understand that there are anywhere between 135,000 and to up to 300,000 people that have Ehlers-Danlos syndrome in the United Kingdom, and those are only the diagnosed ones, and we think that is the tip of the iceberg. So if we take that higher number, in rough terms, that will be about 460 per constituency that all of us would have, and those are the ones that have a diagnosis that we know about. And just at the beginning of this debate, I'm grateful to Dr. Emma Reinhold, who is herself a GP, no longer able to work because she has EDS. And she sent me this quote by Professor Rodney Graham, who is very well respected in this field. And he said as follows: "No other condition in the history of modern medicine has been neglected in such a way as Ehlers-Danlos syndrome." Now, Ehlers-Danlos syndrome, or EDS for short, is a group of 13 genetic disorders in which connective tissue is abnormal, and this results in fragile and hyper-extensible tissues throughout the body, and these can lead to a range of very debilitating symptoms, and the effect on the body is widespread and is not limited to one body system, as connective tissue is everywhere in our bodies. It's a complicated condition and can come with many comorbidities. These can include pain, gut issues, nutrition, cardiovascular, autonomic dysfunction, postural tachycardia syndrome, low blood pressure, mast cell issues, musculoskeletal issues, head and neck issues, and special considerations for both children and women's health, and anaesthetic and surgical considerations are issues as well. So it can lead to physical disability, reduced quality of life, and some rarer types can be life-limiting. And hypermobility spectrum disorders have similar symptoms to the most common type of EDS and are treated in the same way. I'm very grateful today. I would like to publicly acknowledge the support which Ehlers-Danlos Support UK has given me for this debate. They support people across the United Kingdom who are living with Ehlers-Danlos syndrome and hypermobility spectrum disorders. And this is a wonderful charity, and they have been a big driver behind this debate today, and they want us to come here and make a difference, and that is my plea to the Minister. So let me start straight away. Yes, of course, I'll give way to my honourable friend at that point.
Thank my honourable friend for giving way. This is a really important debate, and many people, as my honourable friend has said, don't know about it and don't know about the diagnosis. There is another complication that he didn't mention, which is aortic dissection, which is also something that people with Ehlers-Danlos syndrome can suffer from, and that can be deadly. But my constituent has Ehlers-Danlos syndrome, took 30 years to diagnose. At one point, she was under 11 different consultant teams. Her two sons have got the same symptoms, and they can't access diagnosis or service. So over all those years, over 30 years, there's been no improvement in our care. So I hope that the Minister, when he responds, will be able to give some hope to the people who suffer from this syndrome.
Well, I'm very grateful to my honourable friend, because it is these individual stories, isn't it, which really make the case. And if my honourable friend's constituents had to wait 30 years, that is just, a very, very long time indeed. And answer. But yes, of course, I give way to the honourable lady.
Thank you. I thank the Honourable Member for giving way. And it's a story that I'd like to pick on. A constituent of mine suffers from EDS. And they have frequent trips to the hospital, but every time they go, they'll see a different consultant, quite often treating the immediate medical emergency, rather than taking a more holistic approach and view of their condition. So does the Honourable Member agree with me that people with EDS should be given a single point of contact, somebody who can review their condition as a whole rather than just treating the individual symptom when it occurs?
Well, I think the Honourable Lady makes a very sensible point, and if she'll allow me, as I just progress, I'm going to come on to the 4 requests which the Ehlers-Danlos Support UK want me to put to the Minister, and they are as follows, the 4 asks. So the first is a pathway for NHS diagnosis and care for hypermobile Ehlers-Danlos syndrome and hypermobility spectrum disorders in England. A pathway for NHS diagnosis. Secondly, they want NICE guidelines for Ehlers-Danlos syndrome and hypermobility spectrum disorders. Thirdly, they want a properly coordinated multidisciplinary approach to diagnosis and care for people with these conditions and their associated comorbidities. And fourthly, they want support and training for healthcare professionals to deliver this. Those are all very reasonable and very sensible demands. So to give a bit more background about the condition and work done to bring about change, I'd like to say a bit more about the symptom, as many people aren't aware of it. And whatever knowledge people have, it's undeniable that there's a widespread lack of awareness, and that's part of the challenge that people living with EDS face in accessing care and in dealing with their condition. There are 12 types of EDS are rare and can be genetically tested. But this is a really important point. There is no test for the most common type of EDS, which most people have. And this has led to multiple reports of people being disbelieved by healthcare professionals and by assessors for personal independence payments. And in fact, recent research suggests that those with conditions can wait for up to 20 years for a diagnosis. And my honourable friend from Derbyshire has just told us of her constituent who waited 30 years. And I'm grateful to Danielle Humphreys, who researches in this area. And she's told me that quite a common response from doctors can be, and I quote, "Let me just check Google about this, as I'm not aware of the illness you are talking about, or could you spell that, please?" I do have some sympathy for doctors. 2 of my children are junior doctors. They have a lot to learn in 5 or 6 years in medical school. They cannot know everything. But this is just not good enough, is it? This is affecting possibly up to 500 or more of our constituents. So things need to change. So I'm pleased to put that on the record. Yes, of course, I'll give way.
I thank you for giving way. Now, my constituents have been in touch with me. Actually, a member of my staff has been in touch with me as well, and says just how difficult life is with the EDS. As one person put it, these are horrendous afflictions to live with. Some people can live and work with it, but some can't. Any PIP payments that are received are spent on transport to and from appointments, medications, and private treatments just to make life bearable. Does the Right Honourable Member agree with me that we must do everything that we can to not only improve standards of healthcare, but to make sure that the welfare system can continue to support them?
Well, I do agree very much with the Honourable Lady, and my own experience with some of my constituents has been in assisting them through the PIP process, which has been tortuous for those with EDS. So I'm very grateful to her putting that important point on the record. So as I was saying, Mr. Dowd, the 13th type of EDS is not rare and cannot be tested for, and that's really significant. And recent studies have shown that the diagnosed prevalence of the most common type can be as high as 1 in 227 people, but as I said, most people are not diagnosed. And those with this type, the most common type, are twice as likely to use hospital services. And there is evidence of an additional 29% secondary care cost for them. So this is a significant burden on the NHS. If we understood it and could diagnose it earlier, we could take some of the strain off hospitals, couldn't we? So that is another really important point why we must make, of course, a give way to my honourable friend.
First of all, Mr. Dowd, can I thank my friend and colleague from South West Bedfordshire for giving voice in Parliament to this disease, and we've already heard from a number of fellow MPs about their own constituents, and a constituent contacted me to say that both she, her mother and her children all suffer from this condition, and she's just so grateful that Parliament is finally taking some notice of this condition. I also have a daughter of a very, very close friend of mine, and this gets to the point about diagnoses, that the fact that this is not diagnosed so early on leaves a parent scared, petrified about what is happening to their loved one, and not knowing what the answer is. And does my honourable friend agree, or would he be interested that perhaps the Minister could answer, about whether progress in the analysis of data in the health services about health conditions, so-called big data and AI, may play a role in assisting doctors? Because as my honourable friend says, doctors can't learn everything during their training, but maybe technology can provide some assistance to them.
Well, I'm not surprised that my honourable friend and county neighbour makes such an astute point. And I think he's absolutely right about the power of technology to help the NHS get this right. I'm very grateful to him for putting it on the record. So Ehlers-Danlos Support UK, this wonderful charity which we are so lucky to have, they called on the government last year to provide urgently needed NHS services for those with the most common type of EDS and HSD. And their petition got 28,700 signatures in England. I have to say, however, they were disappointed by the government response. The government said, and I quote, "There are no plans for a national service for diagnosis or treatment of HEDS and HSD. Our plans for musculoskeletal conditions will be outlined in the major conditions strategy." Now, the draft of that strategy stated that people will be supported in primary care and that GPs and expert physiotherapists are being empowered to identify and diagnose HEDS and HSD through the use of validated, approved clinical guidelines and toolkits. Perhaps when the Minister responds, he could tell us a little bit more about what empowered would mean in this context. However, the only toolkit for diagnosing and managing hypermobile EDS is the one created by Ehlers-Danlos Support UK. There are no validated and approved clinical guidelines or genetic tests to diagnose. And also, in the past, EDS UK has always been told that physiotherapists cannot diagnose EDS or HSD. So we do need to do better than this, and what we need is a proper multidisciplinary approach to diagnosing and managing HEDS and HSD. And there are two reasons for this. First, it's a common type of EDS and is therefore not covered by the rare disease plan that is the most prevalent. And second, it doesn't fit solely into the category of musculoskeletal conditions and accordingly will not be covered by the major conditions strategy. Now, like virtually all honourable members here today, I'm grateful to one of my constituents who is here with us this afternoon, Mr. Dowd, Alex Akitici. She has been to see me a number of times, and when she came to see me in January in my constituency advice surgery, I could tell something wasn't right. She was, colour of her face was giving me cause for concern. And at the end of her meeting, when she got up, she collapsed flat on the floor and fainted, full out in front of me. And that was just that was a small example of what this group of people that we are all here today this afternoon trying to help, have to deal with. So it's not just musculoskeletal, because people with musculoskeletal conditions, that doesn't cause you to faint, does it, necessarily? But this is what happened to my constituent, Alex. So she's had to pay privately for a diagnosis. Not everyone could afford to do that. for her treatment and her care. She and her husband have had to spend money adapting her home to make it safe, as her collapses are frequent and unanticipated, as I witnessed. And she lives in constant pain, and she's had the issue with personal independence payments, which was raised by the Honourable Lady just now. And her experience is common. Many people with EDS are also fighting to stay in work, but due to delays in diagnosis and a lack of appropriate care, they end up in a position where they're no longer able to stay in work. And I just want to mention some people with EDS of other MPs who are not able to be here today. So my right honourable friend for Pudsey, Horsforth and Aireborough, the Minister for Sport, who obviously is not allowed to speak into this debate, he contacted me ahead of the debate to tell me about his constituent Fran Healy, who has a connective tissue disorder. She has had to spend thousands of pounds on private health care. She walked from Leeds to Parliament to draw attention to this condition. She's also undertaken a coast-to-coast walk across the north to raise awareness of the condition. What a brave campaigning lady. Thank you to her. My honourable friend from Calder Valley asked me to give a shout-out to his constituent Karen Huntley from Healthwatch Calderdale and Huddersfield, who works tirelessly to highlight the need for a government strategy. And, thank you, Karen Huntley, for what you do. Our colleague, the Honourable Member for North Shropshire, contacted me before the debate to send me details of one of her constituents who has just had an absolute battle royal, to deal with her condition, to get appropriate care, to get recognition for it. And one of my own constituents contacted me earlier in the week and said, both my daughters and grandson have the condition. We didn't realise my oldest daughter had it until she was really quite old, exactly the point that other honourable members have made. So I think we can see that this is widespread, it's across the UK, and it is the same issues coming up time and time again. Now, I want to just draw the Minister's attention, and I'll be winding up sort of shortly, to what is happening across the United Kingdom. So in Wales, members of the Senedd have resolved as follows, that they've said the National Clinical Lead for Musculoskeletal Conditions is working with EDS UK and Community Health Pathways to develop a nationally agreed pathway for hypermobility in children and adults. This will support healthcare professionals to have informed conversations with patients and to provide access to the right specialist teams. This is a major step forward. If it's happening in Wales, what's good enough for the Welsh is good enough for the English, in my view. So in Scotland, in the Scottish Parliament, I'm told there'll be a roundtable debate at the end of this month, which, by the way, is Ehlers-Danlos Syndrome Awareness Month. And in Scotland, they want to try and understand how they can improve diagnosis and care in Scotland. And a recent study launched in Holyrood included a recommendation to develop a pathway and NICE guidelines, one of the requests I made to the Minister earlier, with lived experience as evidence of the need. I would just also ask the Minister, I hope he'll reassure us that he and his officials are looking around the world at best practice, the best research and the best care. I stumbled across the Ehlers-Danlos Society, United States of America, today. Lots of clinicians on that, doing a lot on the research. I hope we are up on what is happening globally so we don't miss out here. Departments do need to look internationally to get best practice here in the United Kingdom. So just as I conclude, I'm the Ehlers-Danlos support. I mentioned the 4 points: the pathway for diagnosis, NICE guidelines, a coordinated multidisciplinary approach, and support and training for healthcare professionals. I'm asking the Minister to really push for this within the department. I know he's a good man. I know he has to get this through NHS England, but frankly, the time really has come to make progress. I would like a meeting, with possible, with him, with Ehlers-Danlos Support UK, who do so much in this space, so we can take this forward. And I'm very grateful to colleagues who've been here. And I think, Mr Dowd, with your permission, I'm very happy for the Honourable Member for Watford to speak briefly.
Dean Russell.
Happy to call him.
Thank you, Chairman, and thank you for your guidance on the timing. I'll be as brief as I can. And I also deeply thank the member for South West Bedfordshire for holding this debate, but also with some embarrassment, because I feel like I should have done this a long time ago, and I'll explain why. I very rarely talk about my personal life in great detail, and especially not those of my loved ones, but my wife has hypermobility, Ehlers-Danlos syndrome, or EDS, as we've called it in this debate. And many of the comments and interventions today, and especially the speech given today, echo very deeply in me from what I've seen for my wife. She struggled since her mid-teens with gastric issues, and I'm going to share some of the experience she has as briefly as I can that she shared with me, because when she heard this debate was happening, she urged me to speak and share her experience. She's had mobility issues for over 15 years now, probably longer, and her experience with the NHS, as wonderful as it can be and as much as I praise it, has not been the greatest. When she's seen GPs, they've either questioned what she actually has, they will question whether it's really what it is, whether it exists a long time ago. Even when she sees the MSK unit, they have no idea how to deal with it. The answer often is physio, but it needs manipulative physio, and you don't get that on the NHS. They'll often throw painkillers in her direction, many of which she's taken, but over time they don't give the same relief. The only thing that's ever worked for her is a proper reformer Pilates, but that isn't on the NHS. And water therapy is very difficult to do when you've got a full-time job, and they're very guided on when it's available. The key points I just want to get across, because many of them have been made, is just the issue of this, is it's like an invisible disease, that it's almost like a vile torment for those who have it. I've seen my wife in absolute agony from doing just the most simplest of tasks. The amount of times I've had to apologise when I've gone to events as an MP where they say, is your wife not coming with you? And you try and explain, well, she couldn't come. But the truth is because if she does come, the rest of that evening, the rest of the day, the next day, she's in agony. And it's very hard to explain this to people. Well, what does she have? And you explain that, oh, I've never heard of that. It's like a disability that isn't classed as a disability. It's like something that affects every part of your body. Yeah, you're not seen as a whole. Every single aspect of this that I've seen through my wife over the past 20-odd years that we've been together is like torment for her. And yet I have to say, from a personal perspective, I love her deeply. I see how strong she is as a woman, and yet I see the pain that this causes for her. And I have deep concern that it just isn't being looked at. There's lots of holistic therapies, there's lots of things that can be done, but when you're treating body parts of a person, and that includes not treating their mental health as well as their physical health, it has a detriment effect on every part of their life. I'm conscious I don't want to take up too much time, but I think I echo the same points that have been made today, which is that the NHS needs to make sure that it's identifiable. Make sure that the training's there, the guidance, and the signposting. We need to make sure things like holistic therapies, like Pilates, that does work for some, is seen not just as a thing over there that sounds nice, but actually is used as a pathway for care. Looking at this condition as a lifelong condition, because as time goes by, we need to make sure that people are looked after as they get older and other conditions come into play. But I would also say that the key aspect here is understanding, and I'm really proud of my colleague for hosting this debate, and as I say, embarrassed I didn't do it myself, because actually if this helps just one or two extra people realise that this is what they need to see their GP about and be forceful, then I think it will make a difference. So thank you for the time.
Thank you. The question is that this House has considered the major condition strategy and people with Ehlers-Danlos syndrome and hypermobility spectrum disorder. Minister to respond.
Well, thank you very much, Mr Dowden. It's a pleasure to serve under your chairmanship. And can I start by congratulating my honourable friend, the member for South West Bedfordshire, for securing this debate on such an important issue, underlined by the sheer number of MPs who have attended this 30-minute debate today. My honourable friend is a tireless campaigner for people living with Ehlers-Danlos, and he was right to bring some of them to the House back in November, and he's right to bring people again today, the campaigners, to sit in the gallery and ensure that their voices are heard. Can I also pay tribute to my honourable friend, the member for Watford, who's spoken from the heart about his wife's personal experience. The month of May is Awareness Month for EDS, and so I want to thank the outstanding charities who do so much to support people living with the condition all year round, especially the Ehlers-Danlos Support UK. My honourable friend said in his remarks that many people might not have heard of the condition. As Minister for Health, and of course during my own constituency work, I come across many people living with debilitating diseases. But it was difficult for me to read some of the stories collected by Ehlers-Danlos Support UK that are collated on their website. There are multiple stories on their website showing what can be achieved when the correct support is provided. Stories like Ellie Owens, who began using a wheelchair in 2018 but returned to France 2 years later to ski again, which underlines what the Honourable Member for Bladen said in her intervention about how the condition affects different people in very different ways. As has been said, whilst there is no cure for EDS or HSD, treatment can help an individual manage their symptoms and prevent the condition from worsening. Early diagnosis is key to making sure patients are offered the most appropriate treatments and are supported to make lifestyle changes to improve their outcomes. NHS England commissions a national diagnostic service for certain rare types of EDS, which can be diagnosed using a genetic test. We do not yet have a genetic test for every type of EDS or HSD, but as the Minister for Life Sciences, I'm hopeful about what the future may bring, a point powerfully made by my honourable friend, the member for North East Bedfordshire.
There were 4 requests that were made by the honourable gentleman. Can I add to that request? In other conditions where the government has appointed an individual MP as the champion for that particular condition, we've seen some remarkable results because the focus is on that. Could the government look at appointing a particular champion? I think we've seen the person who's in line today.
Minister.
Well, it's certainly the kind of thing that I think we would want to consider. There's a whole range of things we want to consider. In the limited time, I'm going to very quickly try and respond to the specific points my honourable friend made. As we know, at the moment, diagnosis for these conditions is based on signs and symptoms, usually by a GP. As my honourable friend knows, NHS England recommends care for patients with non-inflammatory but painful conditions, and that should be provided in primary and community care settings, which brings care closer to home for these patients, in line with our ambitions to get every patient the right care in the right place. Very briefly.
Ashley Dalton.
Thank you. Just on that, I think that it's not only about being able to diagnose the condition. I've had constituents get in touch with me who have been undiagnosed for over 40 years. And what they're saying to me is the big issue isn't necessarily the inability for diagnosis, but the complete lack of awareness amongst medical professions. And so it's not even considered as an option. Will the Minister be able to commit to be able to increase awareness of this serious condition across medical services so that it at least can be something that's considered?
Minister.
I think the honourable lady makes a powerful point. When preparing for this debate, I looked when the last time this was debated in Parliament, and it is a very, very long time ago. So, you know, I pay tribute, strongly pay tribute to my honourable friend for leading this specific date. There have been others. The honourable member for Huddersfield, who is now in his place, has raised this with me in health orals a few months back. So, you know, there are parliamentarians who are pushing on this, but this is the first specific debate we've had in a while. So we've all got a role to play in raising awareness, but I, again, pay tribute to my honourable friend on securing today's debate. My honourable friend, in his speech, made a strong case for a nationally commissioned diagnosis and treatment service. In preparation for this debate, I raised the matter with NHS England, who tell me that they don't yet feel that they have good evidence that secondary care services are more appropriate for patients with hypermobility and pain. And if patients were placed on secondary care waiting lists, it wouldn't necessarily be in their best interests. They believe that if there was clear evidence that a nationally commissioned service would benefit patients, then if that evidence was brought together, I'd be happy to forward those examples to NHS England, and I would make sure that they look very carefully at those examples. And he asks for a meeting between himself, myself and campaigners, and that's something I'm very happy to commit to. So perhaps we can talk through the evidence as part of that meeting to see what is the best way forward. But for now, NHS England take the view that the majority of patients with EDS and HSD can be managed within the community. But as we know, in many cases, diagnosis is challenging, and in recent years we've taken great strides in making diagnosis more effective, giving GPs and physiotherapists comprehensive toolkits developed by healthcare professionals for healthcare professionals. And can I thank the Royal College of General Practitioners for working hand in hand with the Ehlers-Danlos Support UK to get this done. Now, Mr Dowd, EDS and HSD are complex chronic conditions that are frequently associated with other comorbidities. Sufferers may require access to a range of specialists depending on the person. Integrated Care Boards, or ICBs, are responsible for many of the treatment services for patients with EDS and HSD. They have a statutory responsibility to commission services that meet the needs of people in their area and are in lines with national guidance, including guidance from the National Institute for Health and Care Excellence, or NICE. NICE is, of course, as the honourable friend will accept, is an independent body. It would be wrong for me or any other minister to interfere in their decision-making. But I do know that NICE follow these proceedings very carefully, and I know that they would have heard what my honourable friend said in the case he has made for EDS and HSD to be included in their guidelines. My honourable friend rightly says people suffering with the condition should have a coordinated, multidisciplinary approach to diagnosis and care. That's why we're rolling out new primary care networks across the NHS in England. These are delivering more proactive, personalised and integrated care through access to multidisciplinary teams of GPs, physiotherapists, nurses, pharmacists, podiatrists, physician associates and psychiatrists. NHS England commissions some specialist services for patients with rarer forms of EDS. A service for patients who have complex EDS is delivered by centres in Sheffield and in London. And the GIRFT National Specialist Report on Rheumatology, published in September 2021, has made important recommendations for rheumatology units to work more closely with primary care and achieve that properly joined up care that I think we all want to see. Mr Dowd, as my honourable friend notes, patients with the condition frequently have other comorbidities, and this government is committed to giving every patient properly joined up care centred around them. That's why last year we announced we would publish a major condition strategy. The strategy will outline our approach to tackling 6 groups of major health conditions that contribute to 60% of morbidity in the UK, by creating a health and care system focused on prevention, proactive and person-centred management of health conditions. The strategy will focus on the challenges and the changes that are needed in order to make the most significant difference across the 6 groups of major conditions. However, many of the solutions identified will be applicable beyond just those 6 major conditions to diseases like EDS. Aligning work across several groups of conditions for this strategy will allow us to focus on where there are similarities in approach and ensure it's better centred around the patient. Mr Dowd, I would like to once again thank my honourable friend for bringing this to my attention and thank him and other members for their insightful contributions today. My door will always be open to him to hear how we can improve the lives of people living with EDS across the country. And as I committed earlier in the debate, I'm very happy to meet with him and other campaigners to see how we can deliver an NHS that is faster, simpler and fairer for all.
Thank you. The question is that this House has considered the major conditions strategy and people with Ehlers-Danlos syndrome and hypermobility spectrum disorders. As many as of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. Order, order. Can I just ask, hello, excuse me, at the back there, thank you. Could I just ask you to move on, please? Thank you. Thank you, shocking. Right, we'll kick off.